In our last video, I talked about how identifying where a mobility restriction may be coming from is important to be able to address it accordingly. We discussed the difference between opening angle restrictions, more soft tissue, things maybe you can mobilize and stretch a little bit with that sort of approach, versus closing angle restrictions where the limitation may be coming from the joint itself and you have to approach it differently. Another thing we have to think about are the other movements that a joint does that can contribute to why it may feel stiff. It's very easy to think only that a joint does the obvious thing we can think about. So let's take our knee as an example, right? We talked about the hip last week. Let's talk about the knee this week. Well, the knee we often think of, and I'm going to show my elbow for our reference here because it's hard to get my knee on camera. Our elbow, we just think of bending and extending, or flexing and extending. But it also does a little bit of rotation as well, right? We just think of it as this hinge joint, like a door hinge. We don't think of the fact that there's actually a rotational component to the knee itself. And if that rotation stiffens up for whatever the reason, well, the knee may feel stiff in and of itself as well. We may be doing lots of mobility drills, doing different stretches and exercises to lengthen our quads and our hamstrings, and think of things that we're doing to attack the hinge part of the joint itself, but we're not appreciating all the movements that this joint is capable of. So, as an easy example, here's my colleague Dr. Kinney doing one simple drill where he's rolling his shin out on a foam roller, but the idea is to mobilize his tibia while it's in a position of internal rotation to get more internal rotation mobility out of the joint itself, because when that is restricted, it can create stiffness in our ability to bend that knee. So if you have stiffness with knee flexion, with bending that knee, this is a drill that may be helpful. And then what we do is follow it up with a drill where you actually have to use the mobility that we just gained. Move that tibia, that knee, that lower shin bone into a position of internal rotation so we can teach our body to actually use the mobility that hopefully we just gained. And then your body may be able to incorporate that into the normal flexion and extension we think of. Because when your knee is flexing and extending, it's also rotating, and we have to have the prerequisite amount of rotation in order to accomplish those movements, but it's just not obvious to the naked eye, so we don't often think of it. So the take-home lesson, hopefully, of this video is to appreciate what the other movements that our joints may do that can contribute to why we're feeling stiff. So if you are somebody who has just this chronically stiff joint, you have trouble bending that knee, your ankle's always feeling stiff, your shoulders feeling tight constantly, and you do all the stretches and mobility work in the world, all the things you can find on YouTube, but it still doesn't seem to be getting better. There may be these hidden little things that may be contributing to it. So if you're somebody who wants to figure out what those may be, contact us. We'll assess what is going on, give you what those drills are, show you how to do them like in the videos we showed today, and then you can hopefully take it and run with it. If that's something you're interested in, contact us. You know where to find us.